My name is Maryanne Makredes Senna. I am a board certified dermatologist and hair loss specialist practicing at Lahey Hospital and Medical Center in Burlington, Massachusetts. I'm also assistant professor of dermatology at Harvard Medical School. Yeah, so I think what's important to remember is that the minoxidil that we're using now for immediate release was not designed to treat hair loss. It was designed to be a quick on, quick off therapy for people who had malignant hypertension, right? Really hard to treat high blood pressure. So the idea is this was a drug that we could give in much higher doses to people who had malignant high blood pressure that would quickly bring their blood pressure down and then would be cleared from the system, usually within 3-4 hours max. That is not, while it can help us with growing hair, and studies, right, have shown, and our own patient experience has shown that that can work well, there are drawbacks from that type of quick on and quick off, meaning that we're only able to get so much efficacy from certain doses of minoxidil that don't lead to cardiovascular side effects, palpitations, blood pressure changes, swelling, things like this, right? EKG changes. When we try to push the dose for efficacy, we get those side effects. We also don't get interval increases in efficacy when we go up on the dose because the medication is not hanging around the hair follicle long enough. It's coming on and coming off within 3-4 hours. And so the idea and what the study results have shown is that with an extended release formulation, you're able to have the benefits of minoxidil orally hanging around the hair follicle for long durations of time while still staying well below the threshold in the blood that can lead to cardiovascular side effects. Yeah, I mean, I think this is really clinically meaningful. And the reason why I say that is if we look at clinical trials, and of course, this is not a head-to-head clinical trial, right? This was not a comparison against topical minoxidil or oral finasteride. I want to be very, very clear about that. But when we look at the results in total area hair counts from this study, the number of hairs that we're getting per centimeter squared are about 1.5 times that of our best options available to us right now. And so that's really meaningful because not only do we have another therapeutic option, hopefully, to be able to offer patients with hair loss, which our toolbox is really limited. But we have something, hopefully, that will be able to either be used as an adjunct with the other things that we already have, and something that's going to be able to provide the best outcomes, I think, that we have to date based on data, right, that we've seen from other studies that have been done. Yeah, so I think it's going to all depend upon, where the company ends up going with this, where the FDA ends up going with this. So it's hard for me to really comment on that. In clinical practice with any medication, we base that upon, what is the approved dosage if that ends up becoming FDA approved, and then what is the individual patient's goals? Where are they at baseline? How sort of aggressive do we need to be with the treatment? But it's hard to really fully comment on that without, sort of knowing more about what the approved, hopefully, dosage would be.